sometimes when you're introducing rehabilitation with a patient, you might want to consider their level of fitness or their level of awareness of where their shoulder movement is coming from. So whether it's somebody who has never done any exercise before, or whether it's a high-level athlete, sometimes it's good to incorporate movements that are simple and basic so they can get an awareness of where their shoulder movement is coming from. And this is a prime example. So I like to do this all the time with people who haven't exercised before, who are introducing a rehab program into their treatment. So the first thing I would like to do is use either a cane. In this instance, we're going to use a band. So Anthony, if you can take hold of the band, shoulder width apart. And the reason I'm doing this is so that the patient can get an idea of where their shoulder blades are, because we want to keep them stable. So Anthony, if you can raise your arms up to 90 degrees, and I'm going to get him to focus where his shoulder blades are. Your shoulder blades need to stay down on the table. Now take your arms up above your head, or as far as you can go without elevating your shoulders. So as you can see, Anthony is taking his arms all the way up. There's no control from his shoulder blades. He's arched his back, and that is not true shoulder movement. So if you come back to the beginning, this time, we call it proprioception, I'm going to get Anthony to focus on keeping his shoulder blades flat onto the table, elevating his arms, just using pure shoulder movement. So if you take your arms up to 90, and I would only do this with somebody who is comfortable every step of the way. So not in acute situations, but just to improve the range of motion, but also mainly for proprioception. Take the arms above your head, but this time try and focus on keeping your shoulder blades onto the table. So then there is only glenohumeral joint movement. And as you can see, Anthony can go so far, and then what happens afterwards? If you keep going, he arches his back, he needs other movement from elsewhere, so it's not shoulder movement anymore. So that's a good exercise to do. Then, Anthony, if you bend your elbows at the waist, and that's it, and then turn your arms palms to face the ceiling, and then you're going to take your hands across and away from your body at the same time, introducing internal and external rotation. Again, it gives this person on the table an awareness of where that movement is coming from. This is pure shoulder movement. And if you can get them to focus on their shoulder blades staying down on the table, you know that you're introducing some feedback to the movement. That's great. Thank you. And then last but not least, if you turn your palms face down again, you're going to elevate shoulder width apart, straight up in front of you, just to 90 degrees, keeping your shoulder blades down on the table, and then take your arms away from you, so into that scapular plane. Remember, we talked about why movement in the scapular plane is important, and then the other side. Excellent for conditioning the rotator cuff. So simple cane movements, or band in this instant, can be a good starting point if you're wanting to get somebody aware of where the movement's coming from and controlled. I find that in the supine position, you can have great control of a patient who might be struggling with moving the arm altogether. If they're in an acute situation with a shoulder, they've just injured it, or perhaps they're recovering from surgery and they've been under the surgeon's knife. The surgeon has tested that range of movement once they've perhaps repaired a rotator cuff. And they talk about a safe zone, which is a period or a range of movement which won't put the new tendon or the newly repaired tendon under strain. And I find this really, really useful to move somebody in this position. So Anthony, if you can just fold your arms one on top of the other. So if somebody can't move, is struggling to move, has a lot of pain, tightness, weakness, this is excellent. And what I would do is I would start off passive. So I'm going to go underneath his arms and I'm going to raise his arms up so there's no shoulder movement from his muscles at all. So he's going to find that easy. It's all coming from the joint. So if I physically move, there is no strain at all on those tendons that have repaired, or if we're in an acute situation with inflammation, there's going to be no stress to the tissues. So initially, we're going to encourage this kind of movement, and surgeons often talk about a safe zone, usually around this 30 degrees, 45 degrees in flexion, and also 35 or 45 degrees of external rotation. And we can do that passively without stretching or stressing any of the tissues that are recently repaired or inflamed. So I would start off like that, encouraging this cuff to move, because what we want is the condition of the cuff to return back to normal. So I would open out. And then as your patient is slowly recovering, we can ask them to perform the movement. So Anthony, if you raise your arms up and then open the arm out, you can start off and you only go to where it's comfortable and down. Then as things get more comfortable and there's less pain and you know that the person can move a bit more, then we externally rotate and horizontally extend, conditioning those muscles infraspinatus and teres at the back. So open out and a little bit, only going where it's comfortable. And again, the patient is very aware of where their shoulder blades are, and it's a safe position to start. A seated position is an excellent way of performing an exercise which is really important for stabilizing the head of the humerus within the glenoid. We've talked earlier about how important it is to have the head of the humerus centralized in the glenoid for excellent scapular thoracic movement in that scapular plane. So it's a basic exercise, but we start off with a small pillow or a soft ball at the side, and then with a straight arm, Anthony is going to press down against the pillow. But before he does that, I'm going to ask him to stabilize your shoulder blades. So put your shoulder blades slightly back, slightly down, so anchoring the shoulder blades into the back pockets. So we know that that shoulder blade is anchored onto the thorax and in the best position for the humeral head to move. And now with a straight arm, can you now press down against that pillow inferiorly, and that encourages the head of the humerus to inferiorly glide. And relax it, and then watch again. So he's anchoring his shoulder blades, straight arm onto the pillow, nice and straight, and then he's pushing down, moving the head of the humerus in an inferior position. And what we can do as his rehab progresses, and that becomes easy and simple, is to use a TheraBand in the gym or wherever, tie it above somewhere, and then pull down against the band and inferiorly depress the head of the humerus there. So facing the front, turn to the side slightly, and then inferiorly depress that head of the humerus by pulling down. I can't talk about shoulder rehab without performing these exercises. And these are really, really good for most conditions of the shoulder, as long as you're not in a majorly acute situation with lots of pain and lots of restriction of movement. If you're trying to improve your mobility or improve your strength, conditioning the rotator cuff, this is one of my favourites. And this is an excellent way of working the rotator cuff, front and back, internal and external rotators, with a partner. So Anthony's going to demonstrate external rotation and that posterior cuff, which is going to be stabilizing and centralizing the head of the humerus in the glenoid and conditioning the back of the cuff, elbow into the waist, and then externally rotating, palm up against the band which obviously you can incrementally increase the resistance of the band as you go along. Working infraspinatus and teres. And then you can ask a partner to help assist in performing the opposite movement, internal rotation, working subscapularis against a resistance. And it's important to do both when you're conditioning the rotator cuff. But really, really easy to do. And if you haven't got a partner, then tying this end to a door handle and then pulling the band across you, or Anthony will demonstrate the opposite way. If the door handle is over there, external rotation that way. We've talked earlier about the importance of the thoracic spine and shoulder movement. It's really important that there is thoracic mobility. If there are rounded shoulders because of an increased curve at the thoracic spine, then the end range of shoulder movement is compromised. So this exercise is excellent for improving thoracic joint mobility. Now, you can start this exercise seated in the same position as Anthony is, but gliding this foam roller on a table, for example. But Anthony's going to perform the exercise standing. So if you can lean forwards your whole body weight, keeping your core switched on, Anthony, and then glide your arms up the foam roller and lengthen into flexion, you can see the thoracic curve go straighter and come back fully. And then repeat that for me, Anthony. So the shoulders are going up into flexion and the thoracic spine mobility is increased. Now, mistakes can be made here really easily. If you lose core strength and you dip, if you want to demonstrate that, Anthony, if you lose core strength and you dip in the lower back, then you lose the whole point of improving thoracic mobility. So keep the core switched on. And you can see extension of this thoracic spine, which is going to help with all ranges of shoulder movement, particularly that end range. This is an exercise that's really, really important when rehabilitating the shoulder complex. And the reason is because a lot of rehabilitation to the shoulder is to encourage the muscles on the posterior side of the shoulder to strengthen and stabilize. If you think about anterior shoulders often being the problem, upper cross syndrome, the head forwards posture, we want the posterior muscles to strengthen and stabilize at the back, but they can't do that if the opposing muscles are tight at the front, which is the pecs. So this is an exercise that I use all the time with the majority of patients who are struggling with a shoulder problem. So Anthony's in the door frame, his forearm is against the door frame, just below 90 degrees. His core is activated and he can either shuffle through the door frame, stretching the pecs, or he can lean his body weight forwards with the forearm on the door frame, stretching the pecs at the front. I'd hold that personally myself somewhere between 6 and 15 seconds for a good stretch. And like I said, those muscles at the back cannot be activated or strengthened if you have short and tight muscles at the front drawing the shoulders forwards. If Anthony goes back to neutral and then demonstrates where things can go a little bit wrong, if the arm is too high, then sometimes you get overfiring of the traps, which defeats the object of the stretch. You can see his shoulders high and his traps are activated. And then if he goes back to neutral and demonstrates where you lose core stability, again, you're leaning back and the focus is not on stretching the pecs. So leaning forwards, but whilst coming into a pec stretch without any core control is not as effective. So watch out for those. Talked about the importance of the position of the head of the humerus and the position of the scapula on the thorax being important for a good function of the shoulder joint. And one of the reasons that can go awry is when the pecs are short and tight at the front, which is so common if you think about driving, computer work, phones. Most people's activities are in front of them. We've talked about it before. So one of the most common patterns of dysfunction in the shoulder is not helped by short, tight pecs at the front. So this exercise is one that I use all the time and is really, really effective. You cannot strengthen and stabilize the cuff at the back without first stretching the front. It just won't work. So pay good attention to stretching the pecs at the front alongside stabilizing and conditioning the cuff at the back. These shoulder blade exercises refer to the shape of the letters Y, T and W and are commonly referred to as W's, T's and Y's. These exercises I recommend to stabilise the back of the shoulder blade, including the rhomboids, the mid and the lower traps. Initially, we start off just in the T position and progress up to the Y position and then the W position. Anthony's going to demonstrate the T position. So as he leans into the ball, engages his core, arms just below 90 degrees. Anthony's going to horizontally extend and then he's going to totally straighten the arms into the T position and ever so slightly dropping his head forward so the spine is in neutral. And relax. And then when we progress to the Y position, Anthony's going to take his arms up to around 130 degrees, extended, his core's on tight, his head's in neutral, stabilizing the muscles at the back of the shoulder blade. And then relax. And if we go straight into the W exercise, Anthony's going to stabilize his shoulder blades onto his thorax and then bring the arms up into a W position as if he's squeezing the shoulder blades back and the elbows are coming down into his back pockets. And all of those exercises, T's, Y's and W's, and relax, Anthony, can be increased by either going onto the tiptoes or using hand weights.